So when you have diagnosed a person as having suffering from a particular kind of a personality disorder, he has those particular beliefs or thoughts, even when you can call these beliefs and thoughts as delusions, firm beliefs that he has about anything in his life or even about his personality or even about the personality of others. One should know that these beliefs and thoughts are going to have an impact on the behavior of that individual as well. It is going to reflect upon the relationships that he's going to have in his life. Even the work and the stresses of life cannot be coped up with these individuals sometimes. So one has to be very careful while you're diagnosing these individuals. Now, what makes this diagnosis quite clear? It can be a lot of questionnaires that are devised for this purpose. Then it can be a detailed history which is taken from that person, as well as a collateral history. In case of a child, it can be any primary caregiver that he has or we have available at hand. We can get that particular history from these individuals, and this history is going to reflect towards those thoughts and behaviors that he has. So we have these three major clusters at our hand: cluster A, cluster B, and then we have the cluster C. So one should know the traits of the individual and what are the predominant traits that are basically pointing out towards that particular kind of a cluster that we have. So over here in this section, we're just focusing on the cluster A individuals. People who are suffering from the cluster A abnormalities are usually odd and eccentric. This is the summarized definition of the people who are suffering from the cluster A abnormalities. They're quite odd in their behaviors. Their behavior can be distinguished from the normal individuals, and they're quite eccentric as well. So this is the particular kind of the trait that we're talking about right now. We have these three major groups in this cluster A. We have the paranoid, we have the schizoid individuals, and then we have the schizotypal individuals. Usually when we talk about the paranoid individuals, it's basically the individuals who have the delusions of persecutions from the others. This is basically known as the paranoid individuals. The schizotypals are usually the antisocial individuals, and they have to be distinguished from the schizoid individuals. So these two groups have some particular peculiarities that we have to focus on over here. Now, about 78% of people with borderline personality disorder, they struggle with substance abuse or addiction at some points in their life. So the major cause can be the substance misuse in the adolescent age groups, particularly disturbances in how an individual experiences or thinks about himself or herself, about others, and about the world is again very important over here. The maladaptive patterns of cognition. Cognition is basically the thinking process. So if there is any abnormality regarding the thinking process, the emotional experiences can be one of the causes. The emotional expressions and behaviors are the important essential features over here. The maladaptive patterns are quite inflexible when we talk about these individuals. They're associated with significant problems in the psychosocial functioning as well. The range of personal and social situations has to be looked for. So the complete history, the detailed history regarding the socioeconomic status of the individual, regarding the child history, the past medical and the surgical history, the substance misuse history is again very important over here. That is going to lead towards the diagnosis or towards the causative factor that is leading towards this particular kind of a personality disorder that we're talking about. The disturbance is relatively stable over time and is of long duration. The most commonly manifest in the early childhood and most evident in the adolescent period. So the cluster A individual, they refers to a pattern of behavior that is considered to be odd and eccentric. So these two words, they're going to highlight towards this kind of a cluster that is odd and being eccentric. Having those individual characteristics is basically the highlight of this group that we're talking about. It tends to isolate themselves and be suspicious. So they're going to have those antisocial characteristics as well. And that is the main highlight of this cluster, the pattern of social isolation, can be traced into childhood as well. So when we take the childhood history from the parent, he or she is going to give away the history of that antisocial behavior that this particular person had when he or she was in his early childhood. These seldom seeks treatment. So it's not quite a behavior. They're not aggressive in their behavior. They're just isolated. So sometimes they don't need treatment, or sometimes they don't seek treatment. The need of the treatment is can only be established if they are brought to the psychiatric centers or people who are dealing with these personality disorders. So once the people in their surrounding, they're unable to identify this particular kind of a personality disorder, these disorders are sometimes quite undiagnosed, or they remain undiagnosed in that particular individual. So when we talk about the paranoid individuals, they have the pervasive mistrust or suspiciousness of the others. They may suspect others of having the malevolent behavior, be occupied with concerns about others, and be reluctant to confide in others. So they are not going to trust the people around them. This delusions of persecutions are going to be found in these individuals. They are going to basically think that the people surrounding them are not they're unable to trust the people that are surrounding them, even with whom they are in intimate relationships. They're not going to trust these people as well. So this is the major suffering of these people. Be extremely sensitive to the perceived criticism or bear grudges against each other. So this is the major criteria over here. They are going to bear those grudges. They are not going to trust the people around them, and they're going to be preoccupied with concerns about the others. This is the paranoid behavior that they're going to suffer from. Then we have the schizoid behavior. This is characterized by a general detachment from the social relationships, and then we have the restricted range of the emotional expression as well. They are going to consistently prefer isolation to social relationships, generally have a few interests. So they're not going to have those particular hobbies around them. They're going to suffer from that antisocial behavior as well. These are the major characteristics. They are seldom going to engage in the intimate relationships. They are often described as cold or emotionless. Then we move on to the schizotypal kind of a behavior, or the people who are suffering from the schizotypal behavior. They have the restricted interpersonal relationships. There are marked peculiarities in thinking and perception as well. They are similar but not as severe as one diagnosed with schizophrenia. The ideas of reference versus the delusions of reference, it's again very important. So in this section, basically, we summarize the people who are belonging to this cluster A group, mainly the paranoid, the schizoid, and the schizotypal groups are belonging to this cluster A group. So that is the end of this section. Thank you for watching sqadia.com.